So today we're going to talk about games. And I think in our industry, this is a very exciting time. It's the first time that I think we're seeing an opportunity to take games beyond just entertainment, but to a place that can help us live better, healthier lives. And then if you layer in social technologies, the opportunity becomes even greater. Because now, not only can we help ourselves, but we can use social technologies to help us help others. So I'm super excited to introduce our inspiring group of innovative panelists. And we'll start with Michael Ferguson. Michael Ferguson is the Chief Executive Officer and founder of a company called Ayogo. Ayogo creates playable experiences that change the way people learn and interact. Michael believes that playing is one of the most productive things we can do. So we're going to ask you about that in a little bit. Awesome. And he's been an entrepreneur and innovator on the web for over 15 years. And he'll be speaking this year at South by Southwest, Vancouver's F5 Expo, Games and Health, VidWeek, Banff Television Film Festival, and Next Media in Toronto. He's been featured by Fast Company, MIT Technology Review, CBC, and the Globe and Mail. And you can tweet at him at Ferguson.
2 S's in Ferguson. 2 S's in Ferguson.
Next, we have Dr. Katrina Furlick. Katrina is a neurosurgeon by trade, but she's also the co-founder and chief medical officer of Health Prize Technologies. It's a very exciting startup that has this novel solution to the problem of poor compliance with prescription medicine. Katrina is also the author of Another Day in the Frontal Lobe, A Brain Surgeon Exposes Life on the Inside, where I love this. You talk about how a neurosurgeon is actually part scientist, part mechanic, which is kind of cool. She's also the co-inventor of a brain simulation device designed to enhance recovery after stroke, and appears regularly on CNN, Fox, and MSNBC. So thank you, Katrina. We also have, thank you, yes, round of applause. We also have Robin Thurston, who is the Chief Product Officer and one of the co-founders of Map My Fitness. He also had served as the Chief Executive Officer of the company. Map My Fitness is an awesome, awesome company, and if you don't know their tools, they're great training tools, apps, and social networks to help individuals achieve their health and fitness goals. And some of these include Map My Run, Map My Hike, Map My Ride, Map My Try, Map My Walk, Map My Mountain, Map My Fitness, and I Map My apps.
And we just launched Map My Dog Walk, too, so any of you dog walkers out there.
Map My, okay, cool. Robin spent more than 15 years in investment management and actually contributes to developing some of the technology that's used in that world today. Robin rode as a professional cyclist for years and still competes in USCF-sanctioned Masters bicycle races. And you can tweet at Robin at Robin J. Thurston. And last but not least, we have Ben Sawyer, who is the co-founder of Digital Mill. It's a games consulting firm based in Portland. Over 10 years ago, Ben started his career in games and has really taken initiatives to bring to life the area of serious games. He also co-founded the Serious Games Initiative, as well as the Games for Health project, which really brings together professionals in the field and leaders to talk about and share best practices and innovations. Part of his work has been on serious games with the Alfred P. Sloan Foundation. He's also worked as a designer, producer, advisor, and/or manager for projects with Cisco, Cadbury, USAID, Lockheed Martin, and several others. We're very excited to have all of you here, and you can tweet actually at Ben Sawyer, or at Games for Health. Cool. So before we get started, just a quick question for all of you. How many of you played a game today? So whether it's Words with Friends or Foursquare or, yeah, so quite a number. So, gaming is an intrinsic part of our life, and it's something that, sorry, I'm just going to hop over this way. And it's something that not only did we grow up with, but I think continues to be something that we interact with every day. But what is it? So I'm going to start here because Ben's sitting right next to me. So I was. Yeah, you should have sat over there. But Ben, so what makes a game a game?
This is a question that we keep asking ourselves in the game development field. And what's going on right now is really interesting because there is this sort of explosion of what we might consider to be games. Now, one of the things that's important to me is that I started out thinking about this from the sense of what I would call computer and video games, which is important because we believe that the power of a CPU can change the nature of what we do with games. I mean, the explosion that we've seen in gaming the last 30 years has really been about because of the computer. It allowed us to have single-player game experiences, whereas before we had to have, invite people over, and it took time, and then you had to, the board would fall off the table. I mean, it just wasn't the same thing. And with a computer, you get something different. Now what's interesting is we've kind of come full circle.
Right.
Now we're using the power of social media and social networks to create entirely new kinds of games on top of these computationally based single-player experiences. And as Will Wright says, is that we're in this period of a Cambrian explosion of games and computer games and how it all adds up. So it's hard to say what is a game right now. I think it's sort of in flux in a good way.
Interesting, very interesting. Now, Katrina, I'm going to ask you, your company has a very interesting take on this in terms of just looking at compliance. What are your thoughts on kind of what makes that type of platform work? Maybe you can talk a little bit about it and how that's a game.
Sure. Well, just briefly, Health Prize, my company, we reward people for taking their medication. It's one of the biggest problems in healthcare. It leads to about $290 billion in otherwise avoidable medical spending. It's one of the biggest problems in healthcare by far. So we try to motivate people to take their medications, take their blood pressure pill, prevent a heart attack or a stroke years down the line, which is very hard to do. So we use rewards. We also use gaming dynamics, which gets to your question. A game doesn't have to be a game per se, like Angry Birds. It could be getting points. A loyalty program with a credit card, leveling up, gaining points, keeping track of your points, going in a miles program from silver status to gold status. Those are all gaming dynamics, although you wouldn't consider them a game per se. So we use all these sort of mechanics, counting points, sweepstakes, leaderboard competitions. Our platform uses a bunch of different gaming dynamics because different ones appeal to different people. Not everyone cares about a sweepstakes, but they love points. Other people love competitions. They couldn't care less about the sweepstakes. So gaming dynamics is a much broader definition than just a game per se, I believe.
Interesting. And so, Michael, I have a question for you then. We were talking a little bit backstage before we all came out here about the fact that, different games work for different people, different games work for different things, but games may not be appropriate for everything. So if you could just talk a little bit about what you see the best uses of games and some of the projects that you're working on right now.
Sure. So, I just want to start by making a distinction between games and play. Because I think that play is just something that human beings just naturally do. It's how we learn. It's how we interact with each other. So much of what we do is playful. But a game is really a structured environment. And the questions to be asked, I think, in the context of what you just asked is, structured for what exactly? And is it appropriately structured? There's been a lot of great research, going back many decades now, that extrinsic rewards can be demotivating. That is, you pay somebody to do something, and they cease to value the thing that they are doing, and they come to value the reward they're getting. This is problematic in the context of a workplace environment. It's very unfortunate in the context of an educational environment when you're teaching children. It can be catastrophic in the healthcare environment. But that is not something specifically about games. It's about the game mechanic you are using. So I think you can make, because when we're building games for healthcare, our goals are not the play. Our goals are not the game. Our goals are something else. You can build a very successful game, a game that's fun, that's enjoyable, that's engaging, that does all the things that a game should do, and fails utterly to achieve the goal that you want. So it's not a question of, are you a good enough game designer to do this? I think the question is, do you truly understand well enough the problem you're trying to solve, and can you draw a good line between the problem you're trying to solve and the game mechanics you're choosing to apply to that situation?
That's very interesting. Can you help us maybe illustrate some of the best examples? Maybe we can go down the line of games that do what they're supposed to do or change behavior.
One of the most well-known and well-studied was Remission from Hope Lab, which was funded by the Amidyar family. And what they did was they built a game about fighting cancer, and they built it as a sort of metaphorical battle between this nanobot named Roxy that you work with and control, and the human immune system and the cancer that's within the body. And what they found was that people absorbed the information that was in Remission such that it made them more able cancer patients. Now, what's interesting about remission is that it has a combination of rhetoric. It has things in cutscenes where the game just talks to you about these things. But then it also has what my friend Ian Bogos calls procedural rhetoric, where it uses the rules of the game to depict a system that you really need to understand. So in this case, that cancer cells will keep dividing until you get rid of the last one, that this is really a battle to the very end. It's not something like, oh, you feel better, stop taking your meds, it must be working. It's no, you have to continue the entire progress.
So it was part motivation, part education, it sounds like.
But in a different new way that we really, we would argue we couldn't do before.
Interesting. Oh, that's great.
I'd use a specific example, like, again, not necessarily deemed a game, but, points and reward system like Vitality, which Humana sort of bought the company and put Humana over the top of their entire sort of, program to help people sort of get conscious about staying fit and keeping fit and going to the doctor and taking medication and things like this. And there's a tremendous amount of actuarial data that says that it's been very successful in getting people to the finish line or improving their health overall.
Can you tell, for some of us who may not be familiar with the game, maybe if you can describe it a little bit?
Yeah, so basically the way that it works is, you as an individual, for a whole variety of health-related issues, whether it's going to the doctor or getting your blood pressure tested or taking your medication or doing fitness-related activities, essentially are scored points, and those points translate into direct rewards, similar to like an American Express rewards platform.
Great, that's very interesting.
I was actually going to mention remission, but gaming and health is relatively new to the point where we don't have tons and tons of data about things that work. So what we can look to is industries outside of healthcare, at least as precursors, because humans are humans. Right. I mean, you can consider a patient a consumer. You can consider a patient a human being that responds to the same gaming dynamics they do in other parts of their life. And I think the idea of a loyalty program we know works for credit cards, for miles programs. Right. And in that sense, we know they work in other industries. I know health is more complicated than taking a flight by far, but the same dynamics are in play there.
I think it's really important, though, the way this conversation's sort of unfolded, to make a big distinction, though, between these things that are sort of gamification and like reward programs and the things that we sort of game towards an optimal outcome, and what we really consider, in my world, to be video games and game experiences, things that really have the perceptive quality when engaged as being the kinds of things that we think are amazing that we see in front of us on our Nintendos, on our Xboxes, and in our computer games. There is a real disconnect right now going on between these two things. Now, eventually, these things will really kind of start to mash together, I think, more from their respective sort of corners. But I really feel people shouldn't be confused by these two things, because when patients are told, especially if you're looking at people who come from a video game background, hey, you're going to play a game, and then it turns out to be sort of a glorified reward system, that is not what they perceived they were getting. And we need to really go back and think about what it is about the word game that lights people up when they hear it.
That's a really good point. So, let's talk about that. So what is it about being in that mindset about games? What is it that we have this, expectation? Well, we can just go down the line.
Well, I think it's obvious why we have this expectation, because for the last 30 years we've had these incredible march of what we consider to be video games, and we look at what they're doing these days. I mean, when the Wii came out, people just were floored, right? Xbox Live and the Kinect, or Skyrim, which just shipped. These are games that when people see them, even gamers who are a jaded bunch in their own right, they're just like amazed at what comes next. Or even simple things, simple casual games that just keep us compulsively playing, like Plants vs. Zombies or Bejeweled. I mean, these are big deals to people. We laugh at Angry Birds, but it's a $1 billion business now. And there's a reason why, and it's not through points and rewards. Now, points and rewards are really cool, and we could do a lot with them, and I think when you bring the creativity from video games to this other style of gaming, we're going to get something better than what we have right now as we treat them separately, but we're not there yet.
Right.
Yeah, I mean, I would, I agree with everything that you just said, and just add that I think what we're really seeing, the modern expression of an ancient behavior. People the role that games played for humanity was to give us a safe place where we could practice critical skills that if we practiced them in the real world would kill us.
And I think that's very important, is this idea of being in a safe place. You know, there's something about playing a game that we let our guard down. You know,
Yes,
we're more
exactly.
ourselves. We're probably more open to, you know, to thinking, to understanding, to participating, to learning.
Yeah, I mean, the stakes are low on purpose.
Right.
In those gameplay environments, so that we can learn. You know, the application of those game mechanics to solving serious problems, I think, is a really interesting tension. I mean, I talked about that in my earlier comments. I think that's an interesting and very important tension to keep in mind. You know, that our goals cease to be really about the game and be more about the health result. You know, that's a natural tension. But you know, we were talking about serious games. I was going to give just quickly the example of hide and seek, which I think is the most important game ever created and reduced infant mortality in ancient humans by a huge margin, right? I mean, how do kids know how to hide from predators? And we gamified it, and so that's why we're all sitting here.
Interesting. That's very interesting.
What's also, though, is that people have these very meaningful experiences, even within this safe environment. And the other thing that you notice when you talk to when you look at certain types of games is people have an incredible investment in that game, which I think also talks to some of these reward programs, is that games can bring you into a level of investment. My sons and I play a lot of a game called Minecraft, where you build these incredible structures. And if you play on a certain mode, you have to really work to build these structures. You don't just build a wood house. You have to cut down all the trees to build the wood house. You know, 10 hours later, that house, as small as it is, has a lot of meaning. And when my 5-year-old son lights it on fire, there's a big investment that just got lost that he and I have a nice discussion about. And so we've been looking at this idea of investment in games as having meaning. And so now all of a sudden that's a meaning that you can hold up to people and say, maybe this is a way to experiment with the investments in life that you don't want to lose. So you can create these other kinds of dialogues that I think exist in a safe environment. But we shouldn't just think of them, we shouldn't translate that to everybody out here as being casual, because they're deeply seated meanings for a lot of people.
And deeply impactful on things that, from what I'm hearing, we carry into our daily world and our daily life. Robin?
Yeah, I was just going to say, I mean, I think maybe I come from a sports background, so maybe I think about it a little bit differently in terms of that safe environment. But I do think in the end, maybe even at a more sort of like, you know, chemical level, that the endorphins and the idea of having fun is what drives, I mean, certainly when we're now thinking about the 7 million users we have on the site, we're thinking a lot about how do we just create a more fun environment for them to be in? What sort of things do we layer on top in context of gamification or rewards or even true gaming? I mean, integrating with games directly like we have started to do with Xbox and some others. And it's like those things, it is about creating more fun, I think. And that's part of the problem with health in general, is that no one sees it as a lot of fun, right? And when actually people do have fun, they tend to get rewarded by feeling a lot better and engaging a lot more.
That's a very interesting point. We had J.C. Hers this morning talk about the quantified self, and one of the things that came up was this idea of gaming. And one of the things that she talked about was that there's a real danger, actually, when we look at healthcare and games, right? So we're in this territory where we run the risk of creating almost a shallow game that really speaks to some of these things that are just on the surface. So they may not be the most impactful in changing behavior. You talked about this a little bit, but I'd love to hear from all of you about what you think and kind of where the line is.
Yeah, well, I think you do have to improve the intrinsic motivation, and the goal of a game should be eventually to get there. I mean, the game is not the end in of itself. The end is to improve some form of healthy behavior, whether it's weight loss or exercise or taking your medication, whatever the healthy behavior is. That's the end game. So I think, you know, it's a means to improve intrinsic motivation, but you don't want to have it so that when the game ends, the healthy behavior ends.
And then if we can just, sorry, you were going to say?
I was just going to say, yeah, I mean, we do a lot of work in the diabetes area, and one of the challenges with diabetes, of course, when you do the right thing, nothing happens. Right? And it's very difficult to help a child, in particular, habituate good behavior when they're rewarded continually with nothing.
Right.
And And a related problem is that diabetes is continually changing. So what worked for you last month will not work for you again this month. It's a very challenging disease to manage from that point of view. And so, you have to be very careful how you apply game mechanics in that circumstance, that we're not incenting people to do the same things over and over again even when they stop working. So we focus mostly on this, I think, much simpler but equally important problem of getting somebody to do something the first time that's different as the first step towards habituation.
Interesting.
Right, to nudge them away from unhealthy behavior, and also when the right thing happens, to give them something in that moment that says, something good just happened to you. You don't need to. You shouldn't expect that this is going to happen every single time.
Right.
But here's some reinforcement for you right now.
So let's talk about the idea of fun, right? Because games have to be fun, and play has to be fun, or maybe not.
I could
okay,
have a
go
different
ahead.
discussion about this. But let me take something that what JC was talking about and what Michael was just talking about. But one of the interesting things about great games is that the process of playing them is fun. Not just the goal. Like often in a lot of games, like what's the goal of Bejeweled? Everybody knows, get 3 in a row, okay? Like you didn't play it for 5 hours to figure out that goal, right? You got the goal right away. Right, clear the board or something. Usually in RPGs, kill the evil wizard at the end at the bottom of the dungeon. Like, I need to know that. The problem is what makes it fun is the actual process of going there. The journey is its own intrinsic reward in a great video game. That's why Angry Birds feels like so much fun, because literally just pulling back the slingshot and letting it go is fun.
It's the journey, not the destination.
So this is really hard to do. Good interface design that makes the process of play is hard. And as we start to build these health games where we're out in the real world doing things like quantified self, you now have to ask yourself, like, how do you make that interface seamless and fun and interesting in and of itself? Because the tasks you may be asking of people may be the things that they really said. That's not much fun. So somehow you've got to find something else that you're layering into it. And for some people, it might be getting points and rewards. But I think points and rewards are not a process to me as a game player. Something else is, and so we have to figure out what that is.
Interesting.
But the big key that's about to change, at least in health and wellness, in my view, is that you're starting to have all of the friction come out of the system. So it's finally a point where devices will read data in real time and supply that data into a central area where it can be essentially captured by whether it be someone like MapMyFitness or Nike or whoever, and then turned around into these real world experiences, whether that's hide and seek, but you happen to have your health device on, or it's some other type of mechanism. But this is the big change.
Can you tell us? Can you share some examples of these things that are happening right now?
Yes, I mean, certainly Nike Fuel, which just announced, is a good example. The Jawbone Up's a good example. Fitbit. There are others that are coming to market. But some of the big key changes that just happened, like iOS 5 just announced that they're going to allow the accelerometer to run in the background all the time.
Thank God.
Yeah, exactly.
Can we explain for the layman
companies
what
like
that
us have
means?
literally been banging on it for like 3 years.
Yeah.
Come on. So those things are really going to change almost everything, because now you'll essentially be able to start to record all of this data via mobile in a real-time format.
The challenge to game developers is going to be that this is a new joystick, and we have to really think about it as a joystick. And we have to really decide, like, what is this controller going to be able to do? And how does that enable a new process of play that I didn't have before? Because just having it is one thing, but then really shaping it into something that feels that creates that seamless relationship with the games that Michael and his team are doing, and the games that we're working on, that's going to be critical. And we're just getting there. The hardware layer is still really, really rough. But when we all know we're getting there, but unfortunately we have to say to you, give us a couple more years, I think. But it's all headed that way.
So let's talk also about feedback loops and social. So what does it mean? What happens now that we've got these games and now we're adding in this component of social technologies, of tapping into the community? What's been the impact there?
Well, so I'll just give one small example, which surprised us and we thought was significant in one of our games. It was one of our early games. We had it's a game where you're trying to change your diet and exercise to help manage your diabetes more effectively. And so the game is, hey, try something you've never tried before.
What's the name of the game?
The game is called Health Seeker.
Health Seeker.
It's available in fine app stores everywhere. And so the game's called Health Seeker, and the idea is you take on these missions. The missions are to try something you've not tried before. And we kind of threw in this feature we thought would be really interesting. Why don't you challenge your friends to do that too? You know, even your friends who don't have diabetes. That could be very interesting for them to get a sense of the sorts of changes you need to make in your life. When you have diabetes, that's really interesting. So we thought also that sending a challenge to a friend would be really motivating for you, right? So I've got a friend who's going to do it with me. I'm more likely to complete that mission because I challenged that friend. But it turned out, interestingly, that the person receiving the challenge was 3 times as likely to complete it as the person who sent it. So receiving the challenge turned out to be the truly motivating thing. And so we speculate about what this might mean. We think that this may mean that knowing that somebody cares about your health enough to reach out to you with some challenge, hey, I'm doing this, will you do this with me because I care about you? Maybe that's what really matters. But there's something in that human connection that's strongly motivating to behavior. People who send and receive challenges have done, on average, 3 times as many healthy things in our game. So those people who are receiving challenges are doing a lot of stuff. They're the key players in the game.
That's very interesting. Can you repeat that last set? I just want to make sure everybody catches that people who receive these challenges were 3 times more likely?
Yes, they did 3 times as many healthy things on average.
3 times as many healthy things. I think that's important, because as we look at what is the value of tapping into the social community or the connections of someone who is maybe within a diabetic community, or perhaps maybe it's a support community for someone living with HIV. There's a huge opportunity here to engage in what we're calling peer-to-peer healthcare, where what we're seeing is patients helping and supporting other patients.
The interesting thing here is if you look at the design patterns in most social games, right, these games like Farmville and everything else that have gone, hockey stick graph, what's interesting is most of the social mechanics are driven around one concept: to keep the player coming back to spend money, okay, and to get their friends to join them to spend money. But in most of the cases of what we want to do in a health space, we're working on a non-health social game right now in the education space, we've felt liberated as designers because the social mechanics that we need to use don't need to end in that result. So we're kind of like don't have to do certain things that are really prevalent in these games. So it's been liberating in one sense, but it's been debilitating in another, because there's not a lot of prior art to learn from, because every single game is all about like, okay, get them back in 10 minutes and buy a coin. And so we're trying to, I would implore people to go out and look at this and start sharing, because we really don't have a lot of stuff to work with here, because the difference of a nonprofit sort of approach versus a sort of gaming for-profit approach.
Yeah, what is the ARPU equivalent for a health game?
Yeah, no, we're not exactly sure, right?
It's funny, talking about social, the platform we built is largely of interest to pharmaceutical companies that want to support programs to keep people on the medication, to improve outcomes, and obviously to improve the bottom line for the sponsor. But what's interesting is that we're very hamstrung often in healthcare with how social we can be. We can't have people free texting responses to other people on our site, for example. It seems very limited in terms of what we're allowed to do. But even in our very limited kind of social abilities in our platform, we've had a lot of feedback that people feel like they're part of a community. They see a leaderboard, they see other usernames on there. Just seeing those other names and seeing points change, and knowing that there's other people playing the games and taking the quizzes and the challenges is enough to make people feel like a community in some ways, even though it's very weak when you think of other social networks.
That's very interesting. And in terms of a strong community, I mean, what I've seen from the time that I've spent on Map My Fitness, you guys have a very, enthusiastic and active community, and they're supporting each other, encouraging each other to be healthier, to run faster, to run more, to ride more, to try new trails.
The sharing aspect is huge, certainly. I mean, we literally started out on, even today, I think 40% of our daily traffic is organic Google searches for things like running routes in New York. And all of that started because essentially people were sharing routes, right? It was organic. Someone would come onto the site and create a route, and then they'd send a link to a friend, and that friend might post it on a blog, or they might send it out another email, and that might get posted somewhere. And so there was this sort of, huge sharing component. And as we added the other layers in, like, tracking and, certainly like things like events and, the other components of the site like nutrition tracking and things like that, you can start to see the same dynamics working where, someone's saying, obviously I think it's sort of funny every once in a while, accidentally on my Facebook wall, I'll post that I ate like oatmeal for breakfast and I'll get like 50 comments back, and then if I accidentally post that I ate pizza at lunch, people are like, boo, bad for you, so it's kind of amazing the reaction that the community has as you start to kind of push those things and allow the free flow of information back and forth. But it's completely consistent with what you said is, any user who essentially is part of a challenge or is a sort of a higher heightened level user of the site is, 3 to 5 times more likely to stay active and stay energized with the system than if they just did, say, one thing on the site or that type of thing.
Very interesting. So I think at this point, I'd like to open it up to questions from you. So does anybody have anything they'd like to ask? Yes, we have one in the back. Sorry, the woman in the back. Thank you.
Explain a little bit more what you mean. Could you explain a little bit more what you mean exactly by challenge? Does this mean that someone is it kind of like a dare, or is it, match me, let's see who runs the most, who does the most things, or is it more like a dare?
It's kind of all of the above. We have, self challenges that you can create of your own, and that could be, I'm going to run 30 miles this month, or, I dare you to do this thing or not this thing, that type of challenge. And then we also have like large scale challenges, like during the Tour de France on Map My Ride, you can compete against the pros, and actually you could go ride your bike to the coffee store and we'll tell you how fast you would have gone in the Tour de France stage versus, the other riders. So some of them are very big and organized and with partners, and others are essentially self-generated or user community generated.
I think we're just getting to the point of really understanding how to do these types of sort of social multiplayer, asynchronous multiplayer experiences, be it in games or in health settings. And so a lot of the stuff that's being done right now seems, it's pretty basic. It's working just at that level. But, where we're going to be 2-3 years from now as, greater experience designers come into this and we get these real-time metrics, I think it's going to seem like it's going to seem very rudimentary where we are now.
Yeah, I think understanding your audience is a really important part of it. So, for our Health Seeker game, we know that we're dealing with a certain demographic, and the challenges are really dares. I'm going to find a recipe that includes kelp, and you should try it too. And it's awful, by the way, kelp. It's awful. But very good for you, so I recommend you try it at least once. But anyway, so with those kinds of dare challenges, we recently published a game that was for women in their 50s and 60s who are managing their diabetes, mostly type 2s, and so the challenges are totally different in that sense. It's a much more cooperative environment. And so the challenge is, well, I'm going to tell a story about something that happened to me, where I did something to help me manage my diabetes more effectively. I challenge you to also tell a story. Or I'm going to go to bed early 3 times this week, and then my challenge is to come back and tell you about how this has affected my life. How has it improved my sex life? How has it improved my productivity at work? And so telling stories cooperatively is a kind of challenge. It falls into sort of the same category of social motivations.
Excellent. We have another question in the back? Sorry.
It seems like a lot of these games focus on the community, which is pretty much I guess the equivalent of a communal support group. Now, for the role of, say, doctors within this conversation, would the reaction be different if rather than getting a challenge from your friend saying, eat kelp 4 times a week or find something that's got something equally nutritious, if that's coming from a doctor, that challenge from a doctor, as opposed to a friend or even just a general community member, is that a resistance point? And is there a role for healthcare providers within that space still wearing their coat, or is that just not quite there yet?
Well, let me jump in and give 2 examples of that in projects that we currently have underway. So one is a game, it's actually a video game, so an arcade-style game called I Heart Jellyfish. It's for kids to understand and manage their heart rate. So if you are, children are very sedentary, you want them to get more exercise. So the levels and the child wears a heart monitor. The levels are organized so that they get particular power-ups and feedback from the game environment that tells them when their heart rate is in the right range. So it's the clinician who's responsible for determining what the correct ranges are. Right? So there's a separate interface for the clinician to drive that game environment so that the child is directed in, in the way that's most appropriate for their care. The other example I want to give is, I think, an interesting one. We're working with Children's National Medical Center, who does some excellent work on teenagers with HIV. Adherence to their drug protocols is very, very challenging. They're teenagers, they're making this transition from childhood to adulthood, losing a lot of their childhood supports, and they don't like to hear from authority. The last thing they want to hear is a doctor telling them what to do, but they're very peer-oriented. So finding a way to get the peers to speak in the voice, to speak in their own voices, but to articulate the correct behavior, that's a challenge that we're struggling with. There is a right way to manage your drug protocols when you're HIV positive, for sure, but the source of the information is challenging. Human psychology is a subtle thing.
We've had some requests on Twitter as to where people can see some of these examples. So can you share where they might be able to see a case study or perhaps maybe even a video of some of these?
Definitely. I mean, if you come to the Games for Health conference, which we run each June, you could see lots of these things. You can even get a chance to play them. I would just say, in response to the last question, we actually last year did the Game Prescription Project at our conference, where we created a futuristic prescription pad and had people simulating being a doctor, filling out prescriptions for games. And we actually built out a very specific structure to this pad based on anecdotal efforts that doctors were using to prescribe games like Dance Dance Revolution to their patients. And they actually found if they wrote a prescription, the compliance went up. So there is a role for doctors to play. It's a brave new world, so there's going to be all kinds of different things in its way. But I think we have a grand opportunity there. But I mean, also, if you want to see this stuff, I mean, just go online and look. A lot of this stuff is online, available for download. There are YouTube videos of a lot of these things. Look around and see what motivates you, but also look at just all kinds of games, not just health games. Because the game you're going to design is likely going to be based off something that isn't yet been turned into or mashed up with a health problem.
So we have case studies for all of our games posted on our website at Ayogo Games, at ayogo.com, and our Twitter feed is regularly full of interesting projects that we've heard from across the web at Ayogo Games. You might want to follow it. Shahani does a great job of keeping everybody inside the company informed on what's happening.
Great. Does anybody else have any questions? Gentleman in the green.
How do you think about diabetes and other things kind of have solutions built into the illness, or fitness is just fitness. There's no downside to it. How do you think about more progressive, serious illnesses, especially when it comes to kind of moving beyond social media into truly fun, interactive games?
So as an example
of someone who has cancer.
Okay. Well, we started off with remission, right? So.
Yeah, you can share a little bit more about that game.
I mean, we're all about having fun with taking your medication. It seems like you shouldn't be having fun when you're talking about a prescription medication. And most people, when they first hear about our platform, they think, oh, okay, that's for high cholesterol, maybe it's for hypertension. We've had a lot of success in getting oncology brands interested. And when they ask their key opinion leaders, the doctors in the field, they say, I'm all for this. Anything to get people to take their medication, to prevent a recurrence, to prevent a transplanted organ from rejecting. In fact, the number one cause of transplant organ rejections is people not taking their immunosuppressant drugs. Whatever it takes to get that person to take the drugs, fun, games, points, rewards, sweepstakes, whatever, doctors tend to be all for it. And doctors, you'd think, would be the ones that would be mainly against fun and games. But in as serious as transplant or cancer, engaging people however you can is the key.
Just to sort of go back to what I was saying earlier about first principles, when we sit down with our design team and we're thinking about gamifying some circumstance, we think, what is the already existing gameplay here? What is the rules? What is the conflict bounded by rules with the measurable result? Just about every realm of human endeavor can be described that way. So what is the already existing game around compliance? What is the already existing game around managing your diabetes? How are you going to measure it? Will you know when you're successful? What are the markers? What is the conflict? And sometimes it's not obvious, sometimes it's very subtle, but we find that thinking out of it from that point of view lets us, I think, more easily think about how we're going to use the game mechanics, the game technologies that we use, and to draw out that sort of inherent play and the inherent sort of intrinsic motivators of the activity.
Sometimes games aren't fun. I play lots of games that aren't fun sometimes. They're not as fun as some of the other games I play. But what games often have is structure, right? And a very available and accessible interface to navigate through that structure. And sometimes game developers and designers can take a system or a procedure and turn it into something that has an accessibility from a sense of interface. And maybe that's a starting point for
What does
things.
that mean for us laymen?
Well, basically that you can start to understand, what is it that I'm supposed to be doing? Why am I doing it? What are the procedures here? Is it just take this one pill, or is it take these 3 pills? And are there side effects, and how do I manage them? And really starting to understand that self and generate sort of self-efficacy within that system. Sometimes, ideally, can we make it really fun? Can we make you the hero of this incredible narrative? Perhaps. But where it should start is, as was said earlier, is really making sure that you're applying that game structure around the utility that the person needs to achieve. Then from there you can go up. But what I often most appreciate sometimes when I'm working on these things is trying to really reinvent the structure by which someone interacts with something. And then the bonus is, can I really turn it into something that's just incredible in its own right?
That's interesting. We had Frank Moss here this morning from the MIT Media Lab, and he spoke a little bit about some of the things that came out of the MIT Health and Wellness Hackathon. And one of the things, and I think this was actually the winner of the hackathon, was an asthma game for kids. Apparently one of the biggest problems is that kids don't take their asthma medication, and then they don't take their inhalers, and they don't understand the impact of it. So what this game did is help them to measure their lung capacity, their peak flow. They would take their medication, and then they would see the difference. And then all of this information was then transferred to the doctor. So I think layering in that aspect of keeping your physician involved, your HCP informed of what it is that you're doing, plays a big part in how we can do or live better with games. Do we have any other questions? Second row or third row there. Yes, thank you.
Hi, can you talk a little bit about integration with brands or products? Either some examples that you've seen where a brand has done a really good job of kind of integrating themselves within a game, and then maybe also a really bad job?
I saw a heart stents game in Europe once. It was kind of interesting. I don't know.
Wow.
I haven't seen a lot of brand stuff yet. I mean, obviously within pharmaceuticals, there's huge regulatory issues. I've actually seen really that the brands aren't as interested in being front and center yet. They want to be involved. They're experimenting, but they may be sort of, waiting to understand things better. And so I'm not sure I'd be ready to answer that so forcefully at the moment.
Yeah, partly depends what you mean by brand exactly. So I think there's an assumption in your question that we're talking about for-profit companies, but we work a lot with nonprofits, and they have brands that matter. I mean, they need people to know who they are, what they're about, how to reach them, how they're going to improve the lives of the community they serve. So a lot of our projects, that's what they're really about. The brand of the nonprofit is at the front of the game that we're developing, because we're really aiming at that community, and who better to speak to them than somebody they trust.
I mean, what's interesting, though, is that we are getting new brands, right? We Fit is a huge health brand now, right? I mean, EA Sports Active is a huge health brand. If you worked at a major health consumer products company and you walked in and said, I'm going to launch We Fit next week, and you saw the sales, I mean, I think I charted it during its time where it was at its peak, it would have been like one of the top 15 pharmaceuticals globally at retail. So, I mean, you could argue that in some ways, some of these brands are missing the boat, and they're actually allowing new competitors to come in from nowhere. And that's disruptive in its own right. And I think that's going to actually continue.
And what an interesting game. This one's actually, I saw, this is from Novartis. It was a program that they did in Japan. Apparently apparently was a huge problem, and these people were just, these men were working crazy hours, eating a lot, drinking a lot. It's apparently what Mad Men is based on. So this game that they developed was a game that allowed them to measure their heart rate and kind of measure their fitness. And it was an unbranded game, quote unquote, because they didn't include all of the products that Novartis makes for hypertension, and it was an educational game, and it was something that they play with in a community. But I thought it was very interesting as one of the only examples that I've seen of almost creating a branded experience.
Yeah, I mean, some of the health insurance companies are doing too. I mean, a good example right now is Bloom that Aetna built, and it's a good example of I guess I'd say gaming layer over the top of health and wellness.
Right, and Humana has done some games, and Aetna has done some others. I mean, like I said, they're all experimenting, but I wouldn't necessarily say that I've seen the perfect integration of a traditional health product and a game wrapped around it at the moment. But I think those things are coming.
So we're all still learning. So I think we have time for one more question, and then we have a closing question for everybody here. In the back there.
Thanks very much. You guys were just talking about tying in traditional brands, and Ben, you mentioned Wii, which is a preeminent gaming brand and now a hot fitness brand, into your work. And Robin, you mentioned before, I think, tying some of your work with MapMyFitness into Xbox. So, Ben, you sort of just said that we're a while away from it, but I'm interested in hearing about, Robin, maybe what you can tell us about tying these gamified fitness experiences in with more literal gaming products from gaming companies.
Yeah, I mean, so that's an example where, because of our Humana relationship, that a game called Shape Up on Xbox essentially wanted to integrate with the platform. So what we're getting is a lot of requests to essentially take our API framework and integrate it with the site so that you have this, sort of consistency. So even if you're doing something indoors with a pure game, or you are doing outdoors activities, gym activities, we're sort of seeing this centralization of that occurring. And I think the next layer on that is that data will start to come out of our system that essentially, whether it's index level or it's de-identified data, that essentially allows you to potentially compete in a real world sort of situation. So, you could imagine things like, I'm riding my bike on home on my indoor trainer, you're riding your bike on the indoor trainer, and while we're riding down the road, you want to gamify it, you're shooting things or whatever. I mean, you can imagine all kinds of things that are going to come in that iteration in the near future. And I would say a lot of that stuff is in the works. I mean, it's still a little ways off, but the technology is certainly there now.
Well, and the willingness now. I think Microsoft is, I would predict, no offense to my friends at Sony and Nintendo, but I would predict that Microsoft's going to take a big lead here because they're the only of the three big console manufacturers that has an entire health IT division and has enterprise-based software experience and interfaces with those customers as equally as it interfaces with game developers. So they seem to be in a magic spot. Sony's doing a lot as well, and I think with their new ascendancy of Kaz Hirai to the CEO of Sony coming out of their PlayStation division, I think we can expect a lot more. And ironically, Nintendo in Japan actually, Wii Fit does talk to the National Health Service and actually talks to the health record. But it's ironic, because they have a sort of single provider payer, they can do that. It's been harder for them as a Japanese company in the U.S. to really consider the kinds of things that they're doing over there. Konami as well has done a lot of really interesting things to the Bally's fitness of Japan. So there are signs of this stuff out there, but it's like William Gibson said, right? The future's here. It's just not very evenly distributed.
Yeah, I think that's right, and it's a perfect segue to our last question. We're going to do a quick rapid fire here and go down the line. So what's going to be the next thing that's going to shake up this health and gaming world? What's going to be the next breakthrough innovation?
I think a couple of things. I think this world of sensors, we're working with a couple of startups in this space that we're really excited about on our private consulting side. I just think it's all been filtered throughout this panel. I think that's a really, really big deal when these two worlds combine. with gaming.
What do you mean by sensors? If you could
so like the ability to know that you've been walking or running, or your heart rate, or blood pressure cuffs, all kinds of things that we can grab sensory information. The other thing that I think will be big, and that we're working on in the Games for Health project, is really re-looking at what public health styled games, as opposed to these disease state-based axis that a lot of people are fixated on, not necessarily for the wrong reasons, but it's been I think at a detriment about what we can really do when we align the forces of something as consumer-oriented as games and what we want to try and achieve in health. So we're going to be actually doing some stuff on that later this year, and we hope to have some big announcements.
That's great. Thank you. Robin?
I truly believe there's going to be a big crossover between indoor and outdoor, but I think that crossover is really going to exist through mobile. And I'd say our theory is that essentially your phone is going to become your personal trainer. It's going to go into your calendar. It's going to know what your schedule looks like. It's going to identify spots. I mean, we all only have 24 hours in the day, right? We can't find more time. So, but the idea is when you have points where you have, whether it could be that you're just a block from a gym and you didn't know it, or that there's a running group that's leaving at 5 that's within 2 blocks of you and you happen to have your gear with you. But I really believe the phone is going to become your personal trainer and will do all kinds of things, not only from a game perspective, but integrate with sensors, but bring the indoor and the outdoor together, that there will be a balance of those equally, whether you're in the gym or you're actually at home playing a game.
Interesting. That's great. Thank you.
I think one of the keys that needs to happen is to figure out how to engage the unengaged. I think a problem with a lot of these health-related applications, games, wellness companies, is that people who don't really need them, people who are already into their fitness, end up using them. So we have to attract people that aren't likely to Google a wellness app or some sort of game. Somebody who really, really needs the program. We need to entice those people to sign up.
It's a nice challenge we have for all of us.
I think the radical transparency of real-time information about our bodies at all times, I think, is going to change the way that we think about ourselves, the way we think about our health, the way we think about privacy, the way we think about communicating with other people. Already, I just expect, and my kids just expect, especially, to be able to be contacted at any time by anybody. And I mean, it's just become part of our society now, right? We just all assume it. And I think in that same way, it won't be too long before we just assume that we will know exactly what state of health we're in at all times.
Your leg just called.
That's right.
Yeah. That's great. Thank you very, very much to all of you. And if you have questions, tweet. We'll answer. That's great.